Hello everyone. Today's video is about the visual contrast sensitivity test, which is used in some cases for mold assessment, and why that might not be improving in someone. Just before jumping into the video, if you don't mind taking a quick moment to please like, share, subscribe, and/or post a quick comment on the video, I'd really appreciate it. And as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So the question reads as follows. Do you think taking the VCS test, aka visual contrast sensitivity test, is accurate? Mine doesn't even seem to be improving. I'm thinking maybe I should get the mold testing done again. It's been 6 months since the first one. I've been told they think the mold might be from food. So thank you for the questions, and it's a really good question. I've posted, one, I think, dedicated video about the VCS test in the past. So if you're watching this on YouTube or not and want to go over to YouTube, you can just keyword search that and that should come up. But as far as the VCS test goes, to my understanding, it really just tells us whether or gives us good insight into whether there's neuroinflammation going on, and that's like full stop, like that's it. It's not specific to mold in any way, shape, or form. So a person could have neuroinflammation due to a head injury. They could have say a post-concussion syndrome type picture. They could have it due to mold mycotoxins. It could be due to neuroborreliosis, aka Lyme in the brain. It could be due to some viral infection affecting the brain. Could potentially be related to something that's triggering mast cell activation syndrome that's affecting the brain. So there are different things that can cause that neuroinflammation. And so I really, in my practice at least, I look at the VCS test as being sort of a, yes, no, is there neuroinflammation? And then it does also give us a sense of the magnitude of that neuroinflammation, depending on if a person fails the test, then yes, that indicates neuroinflammation. And if they fail it by a little bit, it's just maybe a little bit of neuroinflammation. If they fail it by a lot of neuroinflammation. So it's quite a useful test, but it's not specific to, it doesn't tell us about the cause of that neuroinflammation. Now, in many cases, we can deduce the cause in that it's like, oh, this person had, earlier today, actually, I had a patient where I was talking about this, where we found evidence of mold toxicity as based on symptoms, history, and then also a positive, a notably positive urine mycotoxin test. And then I asked the patient to run a VCS test to establish a baseline, and using that VCS test as a baseline, we're going to use that to track their progress moving forward, because assuming they fail the test, and not everybody with mold toxicity fails the VCS test. To my understanding, it's about 90% of patients who have mold illness will fail the VCS test. So with this patient, assuming they fail the VCS test, then we're going to do our best, strive. You never know what's going to happen, but there's a very good chance we're going to be able to use that VCS test to track their progress, because rather than dropping what works out to be around $450 to $500 Canadian with the U.S. exchange rate, or around $350 US if you're in the States, it's very expensive to do a mold mycotoxin test, and so we can use the VCS test to track progress. Now, what can happen is some folks might test positive for mold on the mold test, and they fail their VCS test, and then we start mold treatment and they aren't feeling better and their VCS test isn't improving. And that might be because the mold is not actually causing symptoms for them, and it could be that the urine mycotoxin test maybe had a false positive, or maybe it's picking up evidence of mold in food that the person was consuming. So maybe the person didn't do a rigid prep diet, and they were eating too many grains and cheese and peanuts and things that are known to be more commonly contaminated with mycotoxins, and so there was a false positive from that perspective. And so in a case where if I had a patient and tested positive for mold, failed the VCS test, then mold treatment's not making them feel better, and their VCS test isn't getting better, then I'd be thinking at that point, either maybe we're just having bad luck and this protocol needs to be revised and we need a different approach, because the first kick of the can with the mold protocol doesn't always work, or another possibility would be that maybe there's something else that's causing this neuroinflammation. So those are kind of my general thoughts on the VCS test. It is I think, a very useful test. I love the fact that it's cost effective, it's very accessible, we get the results back immediately when the patient does the test, but it's not specific. So there's pros and cons to it, but I think it's really useful. I think that I answered everything in there. So anyways, I hope that that information was useful. If the person who asked the question has any follow-up questions on this or whatnot, or if there's some important detail that I missed that made my answer not apply quite the way that they wanted it to their question, just feel free to clarify in the comment section below. If anybody has any questions or comments on this topic or anything else, post in the comment section below. I will do my best to answer as soon as I can.